water or the restroom before we start?
No, thank you. Good
All
to go.
right, so tell me a little bit about what brings you in today. I see you have an AC joint separation.
Yeah, so it happened like 6 to 8 weeks ago, maybe. And it's pretty much back to normal now. There's like an odd sort of clicking in there, and I do get some residual pain if I lift too heavy or if I do too much massage. But overall, it seems to be back to normal. I just think I want a little extra love because I'm sure that I have, you know, been favoring the opposite side, and there's probably some stuff built up in there.
Okay. Is there anything else we're focusing on today?
I do have a lower back injury from a long time ago. It tends to be kind of closer to the spine, like QL area, maybe a little bit of, you know, just like lower back in general heading into the glute. So if we have extra time, I'd like to do that as well, for sure.
And I see on the intake form you have chronic pain and a sports injury circled. Is that all related to the low back and the AC joint?
Yes, the chronic pain is mostly my lower back, and because it flares up if I do a lot of massage, if I have to stand for too long, and again with lifting heavy. It is not the same as the shoulder issue because it's been going on for like probably 10 years, but yeah.
Okay. Any other injuries, surgeries, pins, screws, plates, fusions I need to know about?
I do have 2 little small plates in my jaw. I had jaw surgery a little over 10 years ago. They're very small. They just, massage doesn't really affect them, but you can't like dig at them or they'll get sore.
Okay. And any recent illnesses?
No.
Are you under a doctor's care for anything? Any medications or other medical conditions?
No.
Pregnant or trying?
No.
Okay. And do you hold your stress anywhere? Neck, back, shoulders?
Probably my neck.
Okay.
I do get routine headaches fairly often. I should have circled that on there, but
Okay.
I often forget about them because they're so routine for me. But I'm pretty sure they come from my neck.
Okay. Do you have a headache today?
No.
Did you have one last night or yesterday?
No.
Okay. And any allergies to fruits, nuts, oils, essential oils?
Not topically, not in my skin.
Okay. And are you ready to head on back?
Yeah.
Okay. Follow me. So you have the chair here and the hook on the wall. If you want to hang your clothes or place any of your items here, feel free to use this for your jewelry, glasses, watch, rings, anything like that. Make sure you take off all your jewelry for me so we don't snag it or catch it. And what we're going to do, since you have the shoulder injury, we're going to do a little bit of a different type of massage. We're going to do a sideline massage.
Okay.
But I'm going to start with you on your back, face up. You're going to be propped up against this pillow, almost in a semi-reclining position. This bolster is going to go behind your knees. So we're going to start working with you like that. And then we'll get you onto your side so we can really get into the low back and glute area. That will really be beneficial for your low back pain. And this will just take the stress off of your shoulder so there's not a lot of pressure on that.
Okay, cool.
Do you have any other questions for me?
No, good to go.
All right, I'll give you a few minutes and knock before I come in.
All right, thank you so much.
Thank you. So when you're doing a sideline massage, it's not always necessarily just for our prenatal clients. You can use it for clients who have sports injuries, low back pain, even claustrophobia. Sometimes people just get into that face cradle and it's too much for them. So the sideline is also a really nice option. Since she has shoulder injury, it will also be nice and a little bit more comfortable for her. Anyone who is obese or has a very large stomach or large breasts would also be more comfortable in a sideline position versus a prone position. So always keep an option for your sideline patients because it's more than just prenatal massage. So we're starting out in a modified supine position. So when you're doing your prenatal clients, typically if it's just an hour session, you can start them on their sides. But since we're doing close to a 90-minute session today, we're going to start with the semi-reclining position first. And we'll give her a few moments and we'll check in with her to see if she's ready to start. All set? Okay. And at any point, if you need an extra blanket, if anything I do is uncomfortable, let me know.
Okay.
We're going to start with a little bit of a face and scalp massage. So in this semi-reclining position, I'm actually standing behind her versus sitting on the table, or I'm sorry, sitting on the stool. It's just much easier, puts me at the proper position. to do the face and scalp massage. So being careful of the plates that she has in her jaw, since she reminded us of that during her intake. And let me know about pressure if you need more or less at any point. Some areas might be a little bit more tender than others.
Okay, will do.
It's always nice to start with the face and then go into the scalp. Just prevents any bacteria that may be on their hair from getting onto their face. So just doing some finger walking across frontalis. You can stop and say hello to gallbladder 1. Since she mentions that she has headaches frequently, that would be a nice place to start, even bladder 1 and bladder 2. Some eyebrow squeezes, welcome fragrance. Some nice invigorating work coming through. Work the gala aponeurosis, top of the scalp. You can use your fist through here, save your thumbs. With headaches, this is always really nice to do. Work through the temporalis. Get both sides. See which side feels tighter. That tighter side, give it some extra love. Work through the entire scalp. Make sure you don't miss any spots. It will definitely be noticed when you don't hit something. Always ask for permission if you're going to do hair pulls. It's always nice to make sure the client knows that you're going to do that before you do that. Corinne, would you like me to do some hair pulls for you today?
No, thank you.
Okay. Working back through the back of the scalp, into the occipitals, the attachment of the upper trapezius. And you can start to open up the neck. And again, I'm still standing doing this. This is also very nice because it feels deeper because we have her into a little bit of flexion. So the work will feel deeper even though I'm actually not going any deeper. So you can do all of your basic neck routine with your person in semi-reclining. Now, she doesn't have to be propped up as high. Some people might even just put one pillow on the table. So I can just go ahead and open her neck up to the side, do hand over hand, working through that upper trapezius, and stretch. Come through, do the fulling. Remember, 2 hands on your client at all times, watching your body mechanics, see how your lunge is. When you're doing sideline, you want to make sure your table height is a little bit lower than what you would be working at, because obviously their body is a little bit higher than what you would typically work with them at. So we've gone from one-handed kneading to two-handed kneading. Give it a little bit of friction before you go into that deep longitudinal. How's the pressure for you there?
That's good, thank you.
Feel feels like she has a little spot right through here. Is that tender at all?
Yeah, a little bit.
Does it refer anywhere?
No.
Okay. Would you like me to work this area as a trigger point?
Sure.
Okay. So let me know when this spot gets to a 6 out of 10.
That's about right.
Okay. And go ahead and give me 2 nice deep breaths in and out, your count. And does it feel like it released?
It does. It has eased up a bit.
Okay. Would you like me to go any deeper?
Sure.
Okay. Again, let me know when we get to a 6 out of 10.
Yeah, there you go.
Right there.
Mm-hmm.
All right. Again, 2 nice deep breaths in and out. And did that refer anywhere, or did it feel like it released?
No referrals. It does definitely feel like it's eased up quite a bit.
Okay. So you have the option of doing that again, or doing a PNF. I'm just going to give her a little stretch out, and then we're going to come back to it before we finish. So I'm going to bring her to the opposite side, work through the side where she has the AC separation. Did you see a medical professional or go through physical therapy for it?
I went to a chiropractor.
Okay. And that helped you out?
Yes, definitely.
Good.
And now with a personal trainer, sort of building up the strength back up.
All right. How does this side feel in comparison to the right side? Is it any more tender or about the same?
It's definitely more tender.
Okay. I noticed your breathing picked up there a little bit. Always a good cue. Make sure you're keeping an eye on your client's breathing patterns. How is the pressure for you? Is it okay for this side?
Yeah, it's tolerable for sure.
Come through, and we're going to do some circular friction around the transverse processes. Right side's a little bit,
Heck yeah! That's
a little bit tighter.
Mm-hmm.
And do you need me to lighten my pressure?
No, I think it's okay for now. I just don't want any deeper than that.
So what I'm going to do is go into a counter strain, and that will make that tender area a little bit less tender. Always a good option. Now, if your client wanted more deep pressure, you could put her into a strain and work the area. When you lengthen that muscle, it's going to feel deeper. A little something nice after a little something mean. Come through and work SCM. Hang out with the SCM. It takes a little bit longer for the brain to recognize any trigger points. On average, anywhere from 7 to 11 seconds for the body to realize that there's any type of tenderness or referral pattern there. If you can, try and get both heads. Getting that sternal head, clavicular head. So you can do pretty much, like I said, all of your neck moves with her in the semi-reclining position, or if we just started her in the sideline position, laying on her right side. I'm going to do a little bit of a pin and stretch for that left trapezius. That's basically where we take the muscle, put it into a counter strain, so we're taking the origins and the insertions closer together, pinning the muscle down, and then taking that muscle into its stretch. How are you doing there?
Good.
And again, that's kind of an intense move, so just kind of smoothing that area out afterwards. Same thing to the opposite side. The one movement you might not be able to do in this particular position would be the occipital release. But you can do lateral head rock. Fingers just right behind that transverse process. You don't want to be directly on the edge. It will be a little pokey, a little sharp. Same thing to the opposite side. Nice and slow here. You obviously don't want your person to get dizzy, lightheaded, any type of vertigo symptoms. I'm going to start working through the chest area, opening up the chest. Working through the pec. Be careful because the pecs can be certainly very tender for many, many people. Considering her injury, it's probably going to be very tender for her. Coming down, working through the deltoids, opening up the arm. Can come through large intestine 15, 14, working through the hand, opening the hand up. Being that she's a massage therapist, you really want to kind of get into the thumb, say hello to the thumb. Our eminence.
Lovely.
Never send a man in alone. Always use 2 fingers. And save your thumbs. This is nice, but if you go in between the knuckles, it will save your thumbs throughout the day. And of course, the great eliminator of the upper body right through here. Stripping the arm out. And are you right or left-handed?
I'm right-handed.
Right-handed, okay. Check in with yourself, see where your body mechanics are. Again, she's going to be at a slightly different height than what we would normally work at her with. Once you've worked through the arm, you can give her a little stretch. You can bring the arm across the body. Grab the drape right underneath the scapula. You can bring her over. And of course, because we have modified semi-reclining right through here, we want to make sure she doesn't fall off the table, so don't take her too far. And then you can just give a little stretch, pushing down on the tricep, gripping right at the vertebral edge of the scapula. You can even do a little PNF, have them squeeze their shoulder blades together. 2 deep breaths in and out. Second exhale, release your pressure for me. Hang tight for just a few seconds after the release. Authorized out. Same thing, opposite Again, working through the palm of the hand. Saying hello to the fingers. Being our eminence. A little bit faster through this side. Working through pec major. So now you have the option of going through and working the legs while she's in the semi-reclining position, or you can also do it into the sideline position. So we're going to go ahead and get her into sideline. So what I'm going to do is I'm going to remove the bolster between or beneath your knees. And I'm going to have you start on your right side, so left side up toward the ceiling for me. And I'm actually going to remove this before you start to move, otherwise you're going to be super high. And go ahead and turn so you're laying on your side. And I'm going to have you take that top arm, drape it right over the pillow for me. And I'm going to put a pillow between your knees. So ideally you want the ankle to be in the same plane as the hip, so I'm going to give her something just slightly higher. Go ahead and lift your leg up for me, Corinne. All right. Perfect. So we also have the bottom leg behind the bolster here. We have the ankle almost in the same plane as the hip. Anything higher, she might be out of alignment. So I'm going to leave her just like this. So top leg is on the bolster, bottom leg that's laying on the table is behind. You're going to start by undraping your client. Of course, if you'd like to tuck into their waistband of their underwear, you can. We're going to start by opening up the back. Even though we're only going to be working from the spine up, it's nice to say hello to both sides. And all of your back moves that you learn during basic can be done through here. You get to create your own routine, which is really, really nice. Come through working with a deep longitudinal, forearm saws, and kind of play around what feels good for you. You can kneel during the entire routine, or you can stand. I'm going to work through the thoracolumbar fascia a little bit, loosen that up, come down, work through the attachment of QL. How is that pressure for you? Do you need more or less or the same?
This is fine. No more, please.
Okay. Let me know at any point if you need more or less.
Okay.
Coming through, working through the erectors. Just smoothing everything out. Now she mentioned that she had low back pain, so we're going to work through the QL. Working through that top attachment right at the lower rib, hanging out there for just a few seconds. A lot of trigger points can form right through there. A little bit of friction. Working through there. You can come down and work through each of the transverse processes that it attaches to. Just really isolating the attachment. You can come through, work through the attachment at the iliac, say hello. That can be really, really tender.
It tickles. I don't know if that's
Tickle
normal,
equals tight. So when you think of the muscle, the QL is going to be about right through here. So I don't need to go past anything, right through here over. Can say hello to PSIS down through here. Always feels good for people with low back problems. Now she also has exaggerated lordosis, so the lordotic curve's a little bit stronger than what it would be. So this is also something really nice, just being in the sideline position. Most people who have exaggerated lordosis have a harder time getting off the table after being prone for certain amounts of time. You can sift through the attachment of the latissimus. Also kind of a good spot for low back pain. Coming through, a little bit of friction through that lamina. You'll really get through the rotatories through here. Multifidi. Is that ow good or ow bad?
I don't know why it hurts. It's just tender right there. Yep.
Okay. So tender, I'm going to hang out, kind of explore, see what I can find through here. So the erectors are fairly tight. So you have the option of doing a little bit of cross fiber friction through there, getting some blood flow through there. So right through here, we're also near the lower trap attachment, because right through here we're at about T7, so maybe right through here is about T12, so maybe something might be going on with that, considering her occupation. Definitely some adhesion through that erector. Something you can do that's just absolutely lovely and sideline is coming through and stapling the scapula. So I'm placing my fingers right at the vertebral edge and just pulling her scapula over on top of my fingers. Just feels really, really good to get in between that area. Pay attention to the rotator cuff. You can work through supraspinatus, through infra. The sideline position not only gives you amazing access to the low back, but you're able to get up through the lat through here. This is a common area for trigger points. It's also one of the number 3 muscles that you would want to look at if your client is having problems with numbness or tingling down into the hand. Right through here, you've got your teres, of course, but also your lats come up through here. You can do a lovely little lat sweep, and you can essentially just take your client's arm up above their hand, watch your draping, and do a nice little sweep. This gets, of course, teres major and teres minor while you're there. You can interlock, just don't pull their hair like I just pulled friends. Interlock elbows and give a nice stretch of the lats. So I'm pushing away right at the greater trochanter and then pulling here. And smoothing everything out. Now, if you're starting with just a regular hour prenatal and you've started your client laying this position, you can work through their neck. This is also a really nice way to get a very good stretch on the upper trapezius. You can PNF the levator very well in this position as well, simply by having the client hike up their shoulder. You can also work the arm by bringing their arm onto their body for this. But this, we're going to move on to the hip, frictioning right at that sacral border, working through glute med and minimus, piriformis, and all the rotators. Also a really good position to get the sacrotuberous ligament in as well. You're perfectly positioned to get that glute medius attachment as well as TFL through here. We're going to do some very nice respindling of the IT bands. You can use knuckles, fist, forearm, or elbow through here. You can find gallbladder 30, a little bit of jazz hands. You can also do some very lovely stretches for psoas and quadriceps in this position as well. Just going to come through here, hang out. Corinne mentioned she has low back pain, so you definitely want to pay attention to the glutes. Glute minimus specifically will refer right up into the low back area when there's trigger points. Hanging out. Tough spot right there. How are you doing, Corinne?
Yeah, I can feel that.
Okay.
It's okay, it's just, I can tell it's not happy.
Okay. Why don't you give me nice 2 deep breaths in and out. Let me know if it refers or if it releases.
It is sort of referring.
Okay.
Like maybe down the ITD.
ITD. So chances are that's going to be more glute medius. Glute medius will refer down the side of the leg.
Oh, dear.
Doing okay there?
Mm-hmm.
So we just moved a little bit and found an even more sore spot. I'm going to hang out here for about 10-15 seconds. Let me know if it gets any better, worse, or if it stays the same. At this point, you can have your client do some nice, loud yoga breathing. Really kind of helps release the spot. You can have them think about warm golden light going to the area. How are you doing?
It feels better.
Better?
Like it's eased up some, yeah.
Good. So you can overwork an area very easily. When you're inside line, the work is going to feel much deeper. So you don't want to stay in one area for a prolonged period of time. You're going to leave them more sore than what they need to be. So just spend a few minutes on, go work something else, come back to it. Chances are the tenderness is going to have subsided or decreased. So you can come through here. How's that spot right there?
It's a little bit. It's not as bad as that first one, but yeah. That's not the same as whatever you were just doing.
Nope. So right now we're on quadratus femoris. We're on one of the deep lateral rotators. Working through there. A little bit of tightness.
Yeah, that hurts worse than the first one.
So are we at a 5 out of 10?
Yeah.
5 out of 10? Okay, let me know when it gets a little bit lower. We're going to hang out for about 10-15 seconds.
It's easing up.
Easing up. All right. Come back to it. Now, sideline draping is always a little bit more difficult when you're working with a client in sideline. It will be a little bumbly. It won't be as smooth as when you're working prone or supine. So right now we're going to start working with the IT band, but I'm giving it just a little bit of a warm up. Anytime when you're working with something such as the IT band or the plantar aponeurosis, you want to give it a little bit of a warm up because you can leave tears into the tissue. So I'm going to start working with the top leg. And with this, it's going to be you move it a little bit, you cinch it. You move it a little bit, you cinch it. Now, if you're working with somebody who's pregnant, the pillow there will help serve to keep everything in place, such as the draping. You want to make sure that mommy and baby are covered when you're doing your prenatals, or in today's instances, you just want to make sure your client is covered. So you're going to work up through the leg, a little bit of friction to the IT. Just warms it up. And if your sheet shifts, just make some nice smooth move, like, yeah, I totally am meant to push that sheet back up there. It was totally meant to fall. Do some nice sweeps up, vastus lateralis. You never want to put direct pressure onto the IT band. It's just not comfortable. Just sifting and searching through the quad through here. I see Corinne's foot going, so we're on a pretty tender spot or close to it. You can do a little bit more friction. So the one thing is vastus lateralis actually comes back through here. So the IT band is right here, but vastus lateralis is even still further back through here. Hamstring starts right here. So it's very ticklish.
Woo! I didn't expect that.
And tickle typically means tight.
Okay, that hurts.
So if you use fingertips a lot the way I do, it's actually very pointed and feels much deeper. So you don't actually have to work as hard with that. But we can go into a nice forearm sweep. Watch that wrist, make sure you're not clenching or extending it. Sweep up across the greater trochanter. Hit TFL on the way. You can go in the opposite direction. TFL is typically very, very tender. And we can do some respindling. Make sure that your body is not touching their body. It's very easy to make contact, and that's not something you want to do. We can go into some S moves here. I'm going to redrape her halfway. We also have wonderful access to the peroneals here. Come through here, especially for your runners or your athletes, your triathletes. Definitely want to get through here. You can get through and knead the calf. Sift through the attachments of the lobes. All the way down to the Achilles. Do a little plantar and dorsiflexion. Split the two lobes in half. You can take this time to search in between the two of gastrocnemius. We won't do that today because we like Corinne and we don't want to put her in too much pain. So you also have access to the foot here. We could have done feet while she was still in semi-reclining, but we're just going to say hello to the feet really quick. You can do one or you can do both. It's whatever you want to do. Check out the reflexology video for more moves. Shameless plug, I know. You don't have to do anything fancy. Most people like a good amount of pressure on their feet. If your client is ticklish, try applying a little bit more pressure. Sometimes it's what can override that tickle factor. So, now what we're going to do is give her some nice stretches. I'm going to re-drape her, and we're going to start with a quad stretch. So I'm going to be mindful of the draping, but I'm going to put her foot on my hip and just take her heel to her glute. That gives a nice isolated quad stretch. Do you feel that?
Yes. It's nice.
Hang out for a few minutes, or not a few minutes, but a few seconds. You can also keep her foot on your hip and then bring her into more of a psoas stretch. So I'm not so focused on getting her heel to her glute, but pulling that knee away while pressing forward on the hip. How does that feel, Corinne?
It's good. There's a little bit of pinching in my lower back, but not bad.
So she said there's a little bit of pinching in the low back. I'm going to let off a little bit. When you have somebody that has an excessive lordotic curve, anything that exaggerates it might make it a little mad. So now that we've worked through that, we're going to get her all turned over. So you're going to pull out all of the bolstering. I'm going to take care of that. Always make sure they hold the sheet tight when you remove the pillow from the chest. All set. And you're going to turn toward the window for me, please. Once they're all situated, if you want, you can have them scoot back toward the edge of the table. That way they're closer to you and you're not reaching over the table to work on them. You'll give them back the modesty pillow. Keep it on the outside of the sheet. That way they're not lifting the sheet up to put the pillow underneath. That way they're not exposing themselves. And lift that leg up. Bottom leg back for me, toward me. So if you have somebody that you're doing prenatal massage with, you're going to ignore the bottom leg. There could be blood clots. There's other health reasons you don't want to work through the inside of the leg. Since that's not her issue, we're doing the position today more for comfort. I'm able to work through this part of her leg. This area, because we have more access to soleus and the adductors, it's going to be more tender. So you have to really be careful about what tools you're using. You won't use a lot of fingertips through here. You'll definitely use more fists and forearms because it's just going to be too pokey. You really get an opportunity to work through the calves on the side. So you can do your fulling, your chucking, your kneading, your wringing, all of those. Be mindful of using too much thumbs because it will be a little bit more diggy feeling, a little deeper. But you've got perfect access to the adductors attachments and the hamstrings. So right about here is going to be our delineation between the hamstrings and the adductors. So I'm going to warm up the adductors, or I'm sorry, the hamstrings. A little bit of kneading. Just going to do more broad cross fiber friction on the adductors because it can be so tender. I'm going to work from the inner part of the leg out toward the edge of the table. This just sifts and separates the fascial bags. How are you doing, Corinne?
Horrible.
Do you need me to lighten the pressure?
Yes, just a little bit.
Okay. When you're doing adductor work, one, always make sure you ask permission. Two, check in with them because, again, it's an area that doesn't get worked and is often extremely tight. If your client has limited hamstring mobility, check the adductors. They are known as the fourth hamstring. You can do arm saws. Again, be careful with making contact with the client's body as you do that. Most people don't do a lot of side lying work. It can be slightly cumbersome, but the more you do it, the better you get at it. So now we're going to start on the hamstring work. How are you doing?
Thank you.
So I'm going to bend her at the knee. So we've now got a nice little counter strain going on in the hamstrings and able to sift through them. Just separating them from the adductors. I'm kind of stuck right here, so I'm going to hang out. How are you doing, Corinne?
It feels good.
Okay.
It feels a lot better than the inner thigh work.
Most people you'll find do not like inner thigh work or adductor work. So I'm stuck right close to the attachment, and everything's starting to break up. Going to come in with both fists. You can kind of see I'm skid marking a little bit. We're kind of caught on some adhesions. You can also come through and sift through the hamstrings. And just close out. The other advantage you have with this particular position, you can get into tibialis posterior. So of course, tibia is right here, right at the edge of the bone. We have posterior. So you can kind of sift and sort through that. How are you doing, Corinne?
Phew.
Again, it's an area that's not worked very often, so you have to be super careful through there. And of course, we have kidney 3 right through here. Bladder 60 would be on the outside. Try and keep 2 hands on your client when you are draping and undraping them. And again, we can kind of come through here, work through the opposite hip. How's the pressure there?
That spot, there's like a little spot there that's tender.
About
Yep.
right here?
That's it. Holy moly.
So I'm not using a lot of pressure, but it does feel like that to Corinne. So we're going to hang out here. Kind of work through that. Let me know when that decreases a little bit for you. Give it about 10 to 20 seconds. If it hasn't decreased, we're going to move on and we'll come back and say hello in a little bit.
Yeah, it's pretty sharp still.
Okay. So kind of smooth it out. We can come up through here. We can work through the glutes, see what we have through that. On the opposite side, her glute medius attachment was super tender. How is it on this side?
It tickles.
Tickles.
It's like tickly, not like ha ha, like tickly.
So how does it feel with more of a broad pressure?
Yeah, it's a little less tickly for sure.
If it comes off tickly, try a different tool, see what happens.
Yeah.
So be mindful of your hand placement when you are working on the glutes. You want to keep 2 hands on your client at all times if possible, but you want to make sure you're not putting it somewhere that would be inappropriate. So side lying massages can be extremely therapeutic, not just for relaxation, though most people find it extremely relaxing because this is the position many people sleep in.
Yes, it's very comfortable.
You may find that if you start working with clients in this position, it's something they actually prefer. So now we're back to that one particular spot that was a little more tender than the others. How are you doing?
It's horrible, man. Sorry.
Do you need me to lighten up?
I don't know. I can't tell. I can feel it all the way to my knee.
Okay. On the back side of the leg or on the outside?
Like right here.
Okay.
So like closer, just
quads, but still ITB area.
Okay, so let me know when it starts to inch back up toward the hip, if it does at all.
As soon as you change your position, the radiation stops.
Okay. So when you're
But
dealing,
it's still like, I mean, it's just very tender.
when you're dealing with trigger points, millimeters matter. You move so much as just the tiniest little bit, and you can be right off of it. Okay, so we're on the right spot. Hanging
Yeah,
out.
radiation is not bad. Or it's not there anymore, so.
So radiation or referral pain is gone, which is good. So you can always do gorilla pause. You can come through piriformis about right here. Hers is pretty palpable. So we're going to hang out right there. And of course, right almost in the middle of piriformis is going to be gallbladder 30. So be mindful in this particular position that you're not leaning on the table. Make sure that you're able to support your own body weight. And now you can really see why you need your table height lower, because they're on their side, so they're so much taller than they would be if they were prone. So I'm going to come through and work TFL on this side now. So you can find where the iliac crest is, follow it around to where ASIS is. Just slightly behind that, you should feel a tiny little flip of TFL. Of course, fingers will feel more pointy. Doing okay with that?
Yeah.
Not using the tip of my elbow, but that nice meaty piece right below it. So we're going to come through and work the low back on this side. Just some nice myofascial sifting, excuse me, not shifting, but sifting. Working through that thoracolumbar fascia and lower dorsal fascia. This is just a great way to help mobilize the fascia. Most people with low back pain, their fascia is adhesed. So just sifting through, of course being mindful of the sharp transverse processes and the floating ribs. And Corinne has some nice hyperemia going on. Most of the time when you do myofascial work, people will turn very pink. The skin will become very hot. You can bring the arm up overhead. Again, be careful of the draping for your clients. You can ask them to hold the drape, and you can just do a nice myofascial stretch through here. With fascia, you really need to make sure that you're holding for about 2 to 5 minutes and make sure your positioning is comfortable. Due to timing restrictions, I'm not going to hold this position for 2 to 5 minutes, but just to give you an idea, this is a very nice, lovely stretch. You can go right into that same strip for the lats, coming up and getting teres major, teres minor. Now, of course, you've not seen me use any type of emollient, so we have no oil, gel, lotion on her, so you need to be mindful of the amount of pressure that you're putting on, just because it's going to feel much deeper because we're shearing the layers of fascia. So since this is the good shoulder, we're going to come back. Give her a nice little stretch for the lats. So I'm pulling on her arm, pushing away at her hip. You can also just kind of let that arm hang and do some gentle rocking. As her arm lowers, we're seeing a release in the latissimus. And bringing that arm up and over. Adjust your draping as you need to. Also make sure they're always stacked shoulder to shoulder, hip to hip. Probably should have told you all that sooner, but nice fascial work through here. Being that she's right-handed, this side might feel tighter. So you can spend time through here, sort through the the infraspinatus through here, one of your rotator cuff muscles. Typically about right through here, when there's trigger point, it might even send radiation or radiculopathy down the arm. And that's just numbness, tingling, paresthesia down the arm. Doing okay there, Corinne? Any numbness, tingling?
At one point I got a little bit in my pinky, but it's passed now.
Okay. Really just take your time to search through the muscles. Now, if we hadn't worked her neck in semi-reclining, you could take this opportunity and side lying again. If you have somebody with a very short neck that when you're working them supine, you feel like you can't get into the neck, this is a really awesome way to get in there. You can just do some kneading. You're able to kind of pull that shoulder down, which opens up the neck to you. And you can do your lateral head rock through here. You can do a strain and counter strain. So I can even still feel that one spot we were working on when we first started in the semi-reclining position. So of course you have to remember the transverse processes are poking out right through here. So you want to be careful because if you directly poke into them, it can be sharp. You also have the cranial nerves that are coming out through there, and you don't want to crush or crunch them. You have nice access to levator right through here. Corinne's got a little bit of a scrunchy face going on, so I'm going to assume that's a tender spot.
It was weird.
So right through here, don't forget you're going to have your quarter turn of levator. Don't think you're going to get rid of the Humpty Bump. It's there for life. You can even do a reverse fulling. I like to hold on to their arm to keep them stable, so I'm not just kind of pushing her back. Keeps her stable. We get also a nice stretch on the muscle. You can even do forearm. You can get your client incorporated into the work. Corinne, if you would tuck your chin to your chest for me and let go, release, and tuck, and let go. That just is a different kind of pin and stretch to get into the muscle. You can do a little bit of a pincer work on the upper trapezius, really good for helping find those trigger points. The closer you get to the acromion, more often than not, it's going to be a little bit tender. We'll even radiate or refer kind of like a question mark over their side of their head. You do want to be careful. There's about 30% of the population that have 2 sacs of bursa that attach at the levator scapula. So we don't know who those people are, and if they have bursitis, they might be coming to you with pain in this area, so you don't want to exactly wail on that. And nice stretch. smooth it out. The work can be very intense. Another option you can do, you can just kind of chicken wing your client's arm and do a pin and stretch this way on the shoulder or the upper trapezius. Same thing with levator. Pin it down once you're in a counter strain and stretch it. Come through, work the vertebral edge of the scapula again. She has an adhesion right through here, so we can kind of work through there. A little bit of cross fiber. Doing okay there, Corinne?
Yeah.
Because this work can simulate deeper work, definitely make sure that you inform your client to have tons of water today, Epsom salts, ice, heat, whatever works best for them. So that feels more like a trigger point. What does that feel like for you?
It's very painful, but it doesn't, I don't feel it anywhere else other than where you're pushing.
So there's a definite difference between a tender point and a trigger point. Tender points are just that. They're locally tender. They don't create any type of radiating or referral pain, which trigger points often will. Just going to work through here, see where the most tender spot is. And we're just going to smooth that out. Now you can go back and work the top of the leg here because we haven't worked that side, and the bottom of, or the foot if you haven't already done that. And again, if you hadn't started in semi-reclining, you would work through the arm as well. But we'll just work through this top leg for demonstration purposes really quick, and then we're going to finish up our session for today. So with the draping, there's tons of different ways that you can do it. I like to grab the corner edge of the sheet, thread it underneath the leg, and I hold it tight in the front. And you just kind of shimmy it. And you're going to have to grab the front, and you just make sure everything is nice and covered. I'll warm up that IT band. And again, if that sheet shifts on you, just make sure it's part of a move almost, like I totally meant for that to happen. Working through the hamstring, re-spindle, come down, work through the peroneals. You do want to be careful when you get close to the fibular head. You do have a nerve that comes out through there, so you don't want to use a lot of pressure. You can do kneading. Get into the calf. And one stretch I didn't show you on the opposite leg, I will show you on this one, is the hamstring stretch. So you're just going to support them right above the knee, and you'll walk them forward. And is that as far as is comfortable for you, or can you go more?
Just a little bit farther, yeah.
Okay.
There we go.
All right. So this is Corinne's end feel. If you're not quite sure where your client's end feel is, be sure to talk to them about it. and slowly release and reposition. All right, how are you feeling, Corinne?
Lovely.
Wonderful. I'll step out of the room. Go ahead and get dressed for me. Once you're decent, open the door once you're ready, and I'll be out there to meet you with water.
Okay.
All right, thank you.